Hi, my name is Hannah Garcia, and I am a peer health educator with BroncoFit. I will be discussing binge drinking and the role that college culture plays into it. Binge drinking is defined by the number of drinks consumed in one sitting. For assigned females at birth, that is 4 drinks, and for assigned males at birth, that is 5 drinks. There's a difference between males and females due to a few biological factors that make females intoxicated quicker than males. One drink is not the same for all alcohol types, so it is important to differentiate between them. One drink is equal to 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of hard liquor. There can be some differences of alcohol content within each type, and this graphic highlights some of those differences. Why does this matter? A nationwide survey of 140 college campuses concluded that binge drinking is very prevalent amongst those aged 17 to 23, which is also the age range of most traditional college students. There is a wide range of percentages of students who reported patterns of binge drinking. These percentages ranged from 1% at schools with the lowest rate of binge drinker to 70% at schools with the highest rates. This emphasizes the importance of this topic specifically on college campuses. Additionally, there's a lack of knowledge and awareness about binge drinking. For example, the average college student survey defined binge drinking as 8 or more drinks per assigned male at birth and 6 or more for assigned female at birth. In reality, those numbers are far off from the truth. The next graphics come from the American College Health Association's National College Health Assessment, NCHA for short. The values listed in the graphic reflect the number of drinks consumed and the respondents' last social setting. As we can see, the majority of respondents consumed 4 or fewer drinks in last social setting. However, 19% of male respondents reported drinking 7 or more drinks, which is a vast difference from the female response equivalent of around 7%. This data illustrates how many people in each category have ever consumed alcohol and how many have consumed in the past 3 months. This data also comes from the NCHA's National Reference Group responses and is not exclusive to Boise State students. There are many adverse health effects to binge drinking, some long-term and some short-term. Long-term effects include potential for brain damage, heart problems, liver damage, cancer, and sexual problems and fertility issues. Adverse short-term effects include memory loss or blackouts, nausea, vomiting, alcohol poisoning, and increased risk of overall injury. Death is a potential consequence of binge drinking as well. So, what can we do about this? As we have learned, binge drinking is a large issue that is prevalent amongst many colleges and universities. Squashing misconceptions about binge drinking is one way we can help combat this problem. College students drink, on average, less than what is expected of them. For example, Boise State students assumed that 95% of their peers had consumed alcohol in the past month. In reality, research concluded that only 66% of their fellow students had. This type of data is not exclusive to Boise State students. A few years ago, the popular podcast This American Life recorded an episode titled Number One Party School, in which they dove into Penn State University, which was known as America's biggest party school that year. The Princeton Review chooses a party school each year based on student surveys that cover topics such as Greek life prevalence, study time, and overall consumption of alcohol and other substances on their college campus. The hosts and investigators on This American Life had similar finding. They stated, and I talk about how our data shows that most of our students actually have 5 or fewer when they drink. They, the students, would say, oh, none of my friends drink that little. We're all drinking 8, 9, 10. So this higher level of consumption to them is the norm. This then goes to show how there seems to be a vast disconnect between the perceptions and reality of drinking, especially binge drinking, on college campuses across the nation. At Boise State specifically, educational programs like Alcohol EDU and Sigma training for those in Greek life is a great start to combating this vast problem. Also, re-emphasizing the statistics around the real versus perceived amount of students drinking can help other students understand that drinking, especially in excessive amounts, is not happening as much as they may think. Binge drinking is a serious issue that can have a detrimental impact on one's life. What may start off as a seemingly harmless way to decompress can slowly turn into dependence and then addiction. There are many resources available to help you or someone you may know who is struggling with alcoholism. Some of these resources include Substance Abuse and Mental Health Services Association 24/7 365 hotline for confidential support. Recovery.org and Alcoholics Anonymous are also great resources. At Boise State, counseling services offer alcohol and drug screenings as well as sober support groups. Additionally, care reports can be filed for you or someone you may know. These confidential reports are designed to help assess and find solutions for managing distressing, disruptive, potentially dangerous behaviors. Thank you.